पूरा फ्री
Thank you. A leader is the one who knows the way, shows the way, and goes the way. It is our privilege to have amongst us leaders in their truest sense. I now request our dignitaries, Professor Bilal Panda sir, Dr. Ravikant Sharma sir, Mr. Sanjeev Chaturvedi sir, Dr. Dinesh Awasthi sir, Dr. Manish Shah sir, Dr. Sriraj Shah sir, and Dr. Dilip Maheshwari sir to kindly grace the dais with their presence.
हमारे साथ ही है ना?
हाँ
जैसे माइक तो मैं आपको बताता हूँ कैसे
अच्छा हमारे आवाज़
God is light, and hence there is no darkness. The light of knowledge dispels the darkness of knowledge. I now request our dignitaries on the dais to proceed for the lighting of the lamp for the ceremony. Ardent researchers, practice orators, and true mentors are the qualities of our chief guest, qualities of our guest of honor, Dr. Ravikant Sharma sir, and Mr. Sanjeev Chaturvedi sir. I request our Vice Chancellor, Dr. Dinesh Awasthi sir, to welcome our guest of honor, Dr. Ravikant Sharma sir, with the proceedings. I now request Dr. Sridhar Shah sir, Director and Principal, LJ Institute of Pharmacy, to welcome the guest of honor, Mr. Sanjeev Chaturvedi sir, with the Indian Police. Thank you, sir. With great honor and pride, I introduce Dr. Sridhar Shah sir, Director IQAC and Director and Principal, LJ Institute of Pharmacy, LJK University. Dr. Sridhar Shah sir is a researcher, an academician, a leader and a mentor. He has authored and reviewed number of research and review papers and also books of national and international reputation. He is recipient of various grants, patents, as well as outspoken personality, imparting awareness through mediums such as television, newspaper, and interviews on healthcare and medicine. He has been nominated as independent director and partner of startup company with trademark brands Herbalife and Prub, a technopreneur venture manufacturing herbal dosage forms and cosmeceuticals. It is my honor to request our young and dynamic leader, Dr. Sridhar Shah sir, to come on stage and present the welcome address.
Thank you, Dr. Madam. Sorry, because of the late start. Suprabhat, good morning to all present. Respected Chief Guest, Professor Panda sir, Director NACPAR Mohali. Guest of honor, keynote speaker, Dr. Ravikant Sharma sir, Deputy Drug Controller, Government of India, and the boss of CDSU Ahmedabad. Guest of honor, Mr. Sanjeev Chaturvedi sir, Chairman, IDMA GSB, Dr. Manisha, President, Lok Jagrati Kendra University, Professor Dinesh Awasthi, Vice Chancellor, Lok Jagrati Kendra University, Trustees of Lok Jagrati Kendra, Directors of various institutes, esteemed industry partners, invited speakers, my dear colleagues, scholars and enthusiastic student volunteers. A very warm welcome to each one of you. I hope you are awake. I hope you are energetic. Again, good morning to all. Pleasure. It is indeed a privilege to stand before this August gathering at the International Conference LJPiCON 25, organized by LJ Institute of Pharmacy, sponsored by Glucose, under the aegis of Lok Jagrati Kendra University on the theme, the future of pharmaceutical drug development, trends, challenges and opportunities. This conference is a celebration of collaboration, innovation and vision. It is rightly said, Om Asatoma Sadgamaya, Tamsoma Jyotirgamaya, Mrityorma Amrutam Gamaya. From ignorance, lead me to truth. From darkness, lead me to light. From mortality, lead me to immortality. This profound mantra beautifully mirrors the essence of our conference, a journey from uncertainty to knowledge, from challenges to solutions, and from innovation to human well-being. It is on this strong foundation of values and vision that now turn to our institutional strength, that is Lok Jagrati Kendra University, LJKU, and the LJ Institute of Pharmacy, LJIP. So LJKU, established in 2019, emerges from the proud legacy of the Lok Jagrati Kendra Trust, founded in 1980. The university integrates 13 institutes offering 42 programs across both technical and non-technical courses. With over 11,000 students and more than 550 dedicated faculties, LJKU fosters academic excellence with real-world relevance. LJKU also promotes entrepreneurship through its startup ecosystem, Entrepreneur the Business Incubator, and was the launch site for the Gujarati Startup Initiatives. A pioneer in digital transformation, It has embraced AI-based teaching and blockchain-enabled evaluation for transparency and future readiness. With strong industry partnerships, internship opportunities, and a network of over 50,000 alumni, LJQ is committed to affordable, inclusive, and purpose-driven education aligned with local and global needs. LJ Pharmacy, established in 2004, has emerged a premier institution in pharmaceutical education, research, and innovation, offering undergraduate and postgraduate programs, all approved by Pharmacy Council of India. The institute is also recognized as a CIRO, that is Scientific Industrial Research Organization, by DSIR, Department of Science and Technology, Government of India, a recognition that underlines its strong focus on cutting-edge research. One of our proudest milestones is the NP accreditation of our PFAM program. Further, the Gujarat State Institutional Rating Framework, GSIRS, has placed LJIP among the top 3 pharmacy colleges of Gujarat, awarding us the prestigious 5-star out of 5. This recognition stands as a testimony to our commitment to quality education, outcome-based learning, continuous improvement, research excellence, holistic student development, and of course, collaboration. So the collaboration is the heart of our progress. LJ Institute of Pharmacy, LJIP, maintains strong ties with leading pharmaceutical companies like Intas, Zydus, and IDMA. So we are one of the very first invited associate academic partners by IDMA, and we are very much thankful to IDMA for providing the opportunity for that. We are also tied up with IFPA, the Indian Institute of Public Health, ensuring that our students and researchers remain connected with industrial needs and on the practices. On the global front, our MOUs with NCPHS, USA, UNSC Chapel Hill provide our students with international exposure, collaborative research opportunities, and cultural exchange experiences. Equally significant is our innovation in digital learning. During the COVID-19 pandemic, when the world came to standstill, our faculty created Pharma Ignite, a YouTube-based learning initiative with over 500 educational videos, a subscriber base of more than 800,000, and more than 6.5 lakh views. This initiative ensured the continuity of pharmacy education when students could not be physically present in their classrooms. LJP also supports advanced pharmacological research through its recognition as an approved animal breeding center, including zebra breed facility by the CCSCA, Government of India. The approval places LJIP in a select group of institutes nationally, further strengthening our research capacity. Our research ecosystem is vibrant and dynamic. Over the past 5 years, our faculty and scholars have contributed more than 100 plus Scopus and Web of Science Index publications with a cumulative impact factor of more than 332. Our research spans AI in healthcare, 3D printing of pharmaceuticals, herbal technology, network pharmacology, and novel drug delivery systems. Some of our signature products include the development of AI-driven solid prediction tools for HPLC instrumentation, the design of a 3D printed herbal drug delivery stent for esophageal cancer, and nanotechnology-based targeted drug delivery systems. These projects not only represent scientific excellence, but also carry immense potential for translation into healthcare providers. The strong foundation of research and collaboration naturally leads us to a conference first area, which are NDDS, formulation and process development, pharmacology, toxicology, clinical and regulatory affairs, analysis and QA, pharmacy practice and pharmacovigilance, and emerging technologies like AI, 3D printing, and beyond. With these first areas setting the stage, let us look at the conference impact, highlights of the conference. We are delighted with the overwhelming participation, which includes 400 plus registrations from 30 universities. Can we have a round of applause for that? Thank you. And 37 colleges across different states of India. There are 100 plus undergraduates, 250 plus postgraduates, 25 plus PhD scholars with 330 plus abstracts received. LJPiCON 25 has become a national platform for pharmaceutical excellence. As we celebrate this achievement, it is important to place on record our acknowledgement. I express my deep gratitude to Professor Dulal Panda, our chief guest, for honoring us with his presence and insight. Sir, आपको एक ही बार we have just talked to Panda sir. We have just एक ही बार आपको हमने approach किया, immediately you said yes. So thank you so much for that. Mr. Sachin Chaturvedi, Guest of Honor for his strong support in fostering academia and industry collaboration. Dr. Ravikant Sharma Sir, Guest of Honor and keynote speaker for guiding us with regulatory perspective. Dr. Manisha, President of LJKU and Professor Dev University, Vice Chancellor at LJKU for his visionary leadership. Our trustees, advisory board, faculty, student team for their relentless efforts. A special thanks to Glucose for sponsoring this conference, IDA and GSP for supporting us and bridging academia and industry, Indus Pharmaceuticals for partnering with us as our industry partner. Your contribution have been instrumental in making this conference a reality. With this collective effort behind us, we now turn toward closing reflections. Together, this can transform healthcare into a model that is advanced, ethical, inclusive, and most importantly, deeply humane. I leave you with a thought that perfectly captures the spirit of this conference. Pharmaceutical innovation is not just about creating new drugs, it is about creating new hope. Thank you, and let us make LJPiCON a great success. Jai Hind.
Thank you so much, sir. We extend our gratitude to you for welcoming remarks to our esteemed dignitaries and delegates. Today on our dais, we also have with us Dr. Ravikant Sharma, sir, City Drugs Controller, India, CDHCO Ahmedabad Zone as the guest of honor of our conference. Sir has more than 20 years of experience in CDHCO and has worked in different fields like new drugs approval, import and registration of pharmaceuticals, blood products, etc. Sir plays major role in work related to joint inspections of WHO GMP certificates, manufacturing licenses, etc. Sir is also one of our keynote speakers for today's conference. On behalf of LJIP, I thank him immensely for his gracious presence today. I now request Dr. Ravikant Sharma sir to share a few words.
Thank you, madam, for introduction. Esteemed guests on the dais, Professor Dulal Patani, Sanjit Chaturvedi ji, Professor Dinesh Avasthi ji, Dr. Manish Shah ji, Dr. Shreya Shah, Dilip Maheshwari ji, faculty members, dear students of pharmacy, graduate and postgraduate, good morning to all of you.
Good morning, sir.
Voice is little low, energy is low. Good morning.
Good morning, sir.
Intro. Very nice. At the outset, I like to thank management of Lok Jagruti Kendra University, LJ Institute of Pharmacy for inviting me and to have interaction with you. Our great future is in front of you, us, and you are the future, bright future of India. Many of people you will join the regulatory affairs. Some of you will join the quality control, the manufacturing, the research, the academia. So I am representing CDSU, I am a regulator, and I will talk today about what is our Indian healthcare system. Friends, Indian healthcare system is supported by two verticals. One is the pharmaceutical sector and the other one is the medtech sector. If you see the pharmaceutical sector, we have the market size of approximately $55 billion. And we are expecting to grow it up to $150 billion over a period of 5 years. That is a dream of our Honorable Prime Minister. We are exporting the drugs, the generic drugs, on the affordable rates to more than 200 countries. We are called as the pharmacy of the world. And why we call the pharmacy of the world? The credit goes to our industry. Their commitment, they are maintaining the quality of the products, and every 10th person in the world is consuming the medicines manufactured by the Indian manufacturers. So give a big round of applause here. If we talk about Gujarat, we have approximately 3,000 pharmaceutical units, and out of 3,000, 100 12 means 1,200 are WHO COPP approved units. We are exporting from Gujarat only 25% of the total export. So that is the achievement of the Gujarat. Friends, if you see the medtech sector, because you are the researchers, students, you have to opt either medtech sector or pharma tech sector, but you must know what is the total market size of medtech sector is approximately $20 billion US. But we are expecting it to grow up to $25 billion US over a period of 5 years. But why it is neglected? Because there was no regulation for that. We started regulation of medical devices, medtech equipments from 1st January 2018 only. We are importing more than 80% of the high-tech equipments from other countries. We are dependent on other countries. Why can't we manufacture in India? Why should not be self-sufficient, self-confident and self-reliant? So for this purpose, I will flag 3-4 points in front of you. The first one is innovation. If you see the Indian healthcare system, scenario system, huge disease burden is there. Our patients are from diabetes, and we are called the diabetes capital of the world. So how we can control the disease? We have to discover new techniques for the faster diagnosis and treatment of all these deadly diseases. And what are those? The robotics, machine learning, right? Biotechnology, sensor, point of care devices. We have to discover a lot of things. See, in case of drugs, if you recollect the COVID scenario of new products like tocilizumab, favipiravir, and we have supplied to each and every person. Same way in the medtech sector, we were not having the manufacture of the PP kits for the ventilators, for the oxygen concentrator. But our manufacturers come forward, they manufacture, and they not only cater to our population, but they export to the other country. Because we believe one earth, one family, and one future. We have 7 NIPers. Our director is today with us, and we have 7 NIPers, Center for Excellence in India. So our academic institute should have a collaboration with the NIPer, with the DST, with the ICMR, and they should come forward for the new products and the new medical devices. That is a great opportunity. The second point I would like to highlight, the regulation. You are the students, until unless you are not knowing what is regulation, who is regulating, so you must know that. If you see the regulation, how can we approve the new drugs? NDCT rules 2019, it demonstrates ethics committee role, the sponsor role, the investigator role, what is SND, what is new drugs, investigational new drugs, that is defined in the new drug and clinical trial rules. In medical device rules, we have implemented from 1st January 2018, and we are regulating more than 6,000 medical devices. So from hypodermic syringe needles to the MRI machine and PAC machine, everything is under regulation now. So when you are using any product which is market, you can see what is the manufacturing license on the label. Likewise, we are regulating the recombinants, veterinary drugs, and cosmetics. The third point is the vigilance reporting, the pharmacovigilance. You know about pharmacovigilance? There is a one in IPC, right? There is a center when all the adverse reactions are collected and these are collated. Why there is adverse reaction is caused? The causal assessment is determined, and finally action is taken by the regulatory authority. And the fourth is availability, accessibility, and affordability of the drug. Whatever we are manufacturing, any medical device or any drug, it should be accessible. In the COVID time, we have administered to more than 1.2 billion people the COVID vaccine, free of cost. that you can see only in India, right? And last but not the least, the quality. Quality is the most important. Quality is not an act, it is a habit. And quality can be determined by three ways: by approving the vendors, obsoleting the equipments, proper calibration and validation, and third is the training. So I will stop my talk. I will take you through my presentation in the next one. And Churchill has quoted one line that the greatest assets of the country is the healthy people. We have to work for the patient. We have to work for the patient safety. Thank you. Thank you very much for your kind attention.
Thank you so much, sir, for making us aware about Make in India, innovation, regulation of medical devices. Regarding COVID vaccine scenario, 2 million, we have injected 2 million people free of cost. That shows strong potential of India and its unity. I now request our Vice Chancellor, sir, Professor Dinesh Awasthi, to felicitate Dr. Ravikant Sharma. Please, sir. We extend our gratitude to you, sir, for creating this event. Our next guest of honor, Mr. Sanchit Chaturvedi, is a paragon of vision and leadership. We are privileged to welcome Mr. Sanchit Chaturvedi, Managing Director of Halewood Laboratories Private Limited, a company with over 4 decades of excellence in pharmaceuticals, nutraceuticals, veterinary and food sector, with 7 plants across India and offices in 4 countries. Besides his journey in 2002, at just 19 years of age, he has since expanded Halewood into world's largest manufacturer of ORS and electrolytes, with a presence in more than 55 countries. In March 2025, he became the youngest chairman of IDMA GSB, where there is a vision of race that is focusing on regulatory compliance, academic industry collaboration, investment, social responsibility, and entrepreneurship. May I now request him to share a few words of wisdom with us. Please, sir.
Hello, good morning. Greetings to Dr. Dulal Panda sir, Dr. Ravikant Sharma sir, Dr. Dinesh Awasthi, Dr. Manish Rai, Dr. Srijan Shah, and Mr. Dilip Maheshwari, the Dr. Dilip Maheshwari. So my greetings to you. First of all, what is IDMA? It's been said IDMA. Most of you would not be knowing what IDMA is. IDMA is Indian Drug Manufacturers Association. It's world's largest association with having more than 1,500 manufacturers. So no association in the world has 1,500 manufacturers. We are globally third largest manufacturer of pharmaceutical drugs, and out of that, we hold the strongest body of manufacturers who talk to industry, who talk to government, and most importantly now, we talk to institutes. We give industry academia. So I think when I took over, this was one of the major targets that I took, is that industry and academia association, and the bridge is extremely important. Why? I was just talking to Dinesh Bhai right now that I was in a delegation where I had met people from Harvard, and they said, how much is India's total export? Any guesses how much India exports? pharmacy students, get your numbers. Numbers is everything now. So $27 billion is what we export. You know how much is the budget of healthcare for Harvard? Any guesses there? Just one college. It's $2 billion. So you have to understand, academia is given a lot of importance. Innovation happens in academic institutes. Innovation happens, oh, by the way, by value, though we are third in this world, so basically every third pill in the world taken is made in India. But you know where we are in terms of value? Again, any guesses? Let's participate. We're not third. You'll be surprised, we are 10th in the world. So basically, we are known to make, I wouldn't say cheap molecules, I would say affordable molecules. But are we there in innovation? We're actually not. We're nowhere in innovation. But why, have you realized why we are not in the innovation? So I'm not going to talk about the technical part of it. People sitting here are way more qualified than me to talk about the technical aspects. As an industry, I would really want all the students especially to understand a few things. What are the expectations of industry? I believe every student here would want to join healthcare industry eventually and different segments of healthcare industry. But why only few succeeds and why few really don't? So I think I had a chat with a lot of them, right from Pankaj Bhai to the person who started his industry just few months back or years back. So I think lastly there are few commandments, if you all feel right, do implement eventually, because see, success, there is no formula to success, right? There could be commandments, there could be suggestions, you could have your own way, but largely this is the base, what I'm going to try and speak it out to you. So every time you make a decision, the first one is I want you all to keep asking just one question till you find the right answer. That one question is why. I want to go into pharmaceuticals, why? I want to become a second largest company by 2035, why? So keep asking till you have clarity of the vision as to what you exactly want to do. Once you have that answer,